Good afternoon. And thank you for joining us for Mind and Soul, Mental Health and Well-Being in the Black Community. I'm Tabbye Chavous, Vice Provost for Equity and Inclusion and Chief Diversity Officer at the University of Michigan. Before we begin, I'd like to acknowledge that the University of Michigan is located on the traditional territory of the Anishinaabe people. In 1817, the Ojibwe, Odawa, and Potawatomi Nation made the largest single land transfer to the University of Michigan. This was offered ceremonially through the treaty at the foot of the rapids so that their children could be educated. Through these words of acknowledgement, the nation's contemporary and ancestral ties to the land and their contributions to the university are renewed and reaffirmed. Today's discussion serves as part of the University of Michigan's 2022 Diversity, Equity, and Inclusion Summit, an annual series of events that brings together the campus community to spark university-wide engagement and encourage critical thinking about ways to address structural inequities across our campus and the broader society. The theme for this year's summit is DEI, Nurturing the Heart, Mind, and Soul. Today's event is an important contribution to our summit as it further builds upon and expands the exploration of this year's theme. Our topic today is one that is personal to many of us, and it is critical as we aim to create and promote healthy environments in our schools, workplaces, community spaces, and indeed, as we seek to nurture the heart, mind, and soul. The issue of mental health and emotional well-being among marginalized communities has been elevated as we continue to deal with the long-term impact of the COVID-19 pandemic. During this same period, our nation has experienced a myriad of discriminatory and violent incidents against communities of color. As our nation and university community continue to struggle with addressing these dual pandemics, today's event affords us the opportunity to explore mental health and well-being, specifically in the Black community. Throughout my career, I have been fortunate to work with scholars and leaders to advance institutional and national efforts surrounding mental health and well-being in Black communities. I'm also extremely proud to have several individuals who I have worked with previously and whom I greatly admire join us for today's discussion. Among them is Dr. Christina Morton, who, while a PhD student at the University of Michigan, created a spoken word piece that she will share with you in a moment. Dr. Morton recorded and included this piece as part of a toolkit for faculty, staff, and providers focused on supporting the well-being of students of color that I hope you will explore further. It was developed in collaboration with our partners at the Steve Fund, a national nonprofit organization dedicated to promoting the mental health and well-being of young people of color. I welcome you to attentively view, listen, and reflect on Christina's piece, which helps to frame our conversation today. Christina.
Thank you so much for your remarks, Tabbye. This piece is called The Wait. Wake, wash, dress, grab bag, then pack. Laptop, books, pens, then anxiety, then fear and depression. Carry it all. Feel the weight of it digging into shoulders, straining neck, tightening lower back, but I carry it nonetheless. Keep moving, I say. Just keep moving. If you don't stop, they won't catch you, can't hurt you. No time to rest. Just keep going, and maybe one day you'll be free. Free, free. Was this the prayer my forebears prayed as cotton bolls burrowed beneath fingernails and the lash scored sweating backs bent in the unrelenting sun? When nursing babes were torn from their mother's breast before milk cooled on their lips, and auction blocks fractured fraught families? I wonder, did they dream of death too? Imagine angels sweeping them away in the dead of night, unbeknownst to an exacting master, and flying high, high above the suffering, the pain. If slavery is such a distant past, why am I still trying to recover? But I am a descendant of survivors, a people who had the audacity to live, a precious inheritance they gave me, this life. To live is resistance, a daily act of defiance, yet let's not forget those who had the courage to die, to swallow death rather than drink the bitter cup of bondage. They mean to kill you, child, they whisper, but you can't die here. Not now, not like this. You are a survivor too. So I keep moving, carrying the weight. You want to know what's on my mind as I walk? Hope. Hoping I don't disappoint those who came before me. Hoping I don't forget who I am here. Hoping that my father takes his medicine. Hoping that my baby sister remembers the sound of my laugh. Hoping that I pass this test. Hoping that I don't fall short of perfection. Hoping that I don't drown in others' expectations. Hoping that I don't let the exhaustion show. Hoping that I leave here still standing. Hoping, hoping, hoping. I can't afford to stop hoping. The cost unspeakable, unthinkable, unbearable. There are days when all I have is this hope. Without it, I worry I may fall apart. You want to know if I'm broken? The answer is, I should be, but no. I am but one in a lineage of people who were broken by design, in body, in mind, and some in spirit, intentionally unmade, ill-used and despised because of the skin their souls occupied. Perhaps you can relate. My indigenous brothers and sisters, my Latinx hermanos y hermanas. Yes, they meant to break us. But with time, we took the bits and pieces left and repurposed them, refashioned ourselves in the image of God, relearned how to be whole, and dared to say, we are beautiful. Because of them, I know that I don't walk these halls alone. I shoulder this weight, but not by myself. I am but one in a lineage of people who chose to live in spite of the oppression, in spite of the hate, in spite of the lies they told us. Unfit, unqualified, undeserving, in spite of it all, they kept moving toward freedom, and so will I. Maybe one day I can release my burden. I want to, for them, for me, for my children. But today, I carry it, but I still hope for tomorrow. Will you hope with me? We need each other if we're going to make it to freedom. Thank you.
Thank you, Christina. The audience probably could not see me pumping my fists and swaying with your words, and just thank you. I can see the chat and people's appreciation and resonance. For all who have carried and continue to carry the weight, and for those of you who are supporting others who are carrying the weight, today's event is for you. Christina's piece reminds us that we must acknowledge the histories and experiences of our families and communities while considering our current context as we work towards supporting mental health and well-being in the Black community. In my own research on Black adolescents and young adults, We have found that approaches to supporting minoritized young people will be incomplete if they focus only on individuals and not centering issues of context. We must work to examine and address the systems and the structures that support or undermine the optimal thriving of our young people and our community. In doing so, we must adopt a multi-generational and an intersectional approach to promote the flourishing of individuals and communities across the lifespan. Today, we will be joined by scholars and leaders who are at the forefront of advancing research and interventions related to the mental health and well-being of the Black community. Earlier this year, some of these scholars contributed to a special issue of Currents, the Journal of Diversity Scholarship for Social Change, and they focused on mental health among marginalized communities. I encourage you to explore this special issue to further inform your policies, practices, and efforts. The special issue offers insights into the shared and unique mental health experiences and needs across marginalized communities, and how multiple and intersecting identities should be taken into account when developing interventions. We hope that today's event will spark and inspire something inside of you, some curiosity to learn more about how society shapes and impacts our mental health and well-being across our lifespan, a deeper interrogation of systemic racial inequalities, or a more profound understanding, awareness, and commitment to support the mental health and well-being of the Black community. Before we get started, I want to thank the staff at the National Center for Institutional Diversity and their work through the Anti-Racism Collaborative as they continue efforts to inform practice and action through an anti-racist lens. And with that, I am pleased to turn things over to Dr. Elizabeth Cole, Director of the National Center for Institutional Diversity, Professor of Women's and Gender Studies and Psychology and Afro-American and African Studies, and University Diversity and Social Transformation Professor at the University of Michigan. Dr. Cole, a distinguished scholar of race, gender, and intersectionality among many areas of expertise and accomplishment, will moderate our distinguished panel discussion. Take it away, Liz.
Thank you, Tabbye. We are fortunate today to be joined by 4 experts in this area who will be speaking with you for the next hour or so. Our first guest is Dr. Lauren Lee Brown, who's an assistant professor of health management and policy at San Diego State University School of Public Health. We have Dr. Shauna Leith, assistant professor in the psychological and brain sciences department at Washington University in St. Louis. Dr. Carmen McCallum, associate professor of leadership and counseling and director of the McNair's Scholars Program at Eastern Michigan University. And last and certainly not least is Dr. Christina Morton, who's the associate director of the program on intergroup relations here at the University of Michigan in the College of Literature, Science, and the Arts. So I want to start by talking a little bit about what brought you into this work. We know that you're joining this panel as experts and scholars, but we also want you to bring your whole self to the conversation and to talk about how your many identities have influenced your work, whether it's as a community leader, as a caregiver. So why don't we go ahead and start with Christina, since your spoken word poem helped us start our event today. Could you talk a little bit about your inspiration or the motivation for the piece that you shared?
Thank you so much, Dr. Cole. I honestly, with that piece, it stirs up so much. So I'm grateful that I wasn't on video right after, because you gotta pull it back together. I think one of my primary inspirations was my own experience being an undergraduate student when I was at the University of Michigan, graduate student at NC State, and then back at Michigan again. And just those moments where I would find myself in front of the mirror, needing to get dressed, get ready to go to class, get ready to go to this meeting, and having all of these feelings, right, that I didn't feel as though I had time to fully process or unpack but it was like, I knew I just carried it with me all day long, right? You know, the very beginning of the poem is like, you know, you're getting up, you're getting ready, and you're putting anxiety and depression and all sorts of things in that backpack with you. And in those moments, you know, where I took courage were the reminders that I have ancestors and people who are still living, who've gone before me and who've walked this path and who've taken this journey, who are with me, you know, right now. I'm like, one of my mentors is on this little Zoom right now. Shout out to Dr. McCallum, and shout out to Tabbye as well. So, you know, it's all of those reminders of, yes, I'm a child of survivors too. And there will be a time, there is time for me to think about what all these emotions are that are stirring up within me and my mental health and my personal well-being. And, you know, I'm not doing this alone. There are other folks who are right there alongside me, who are ushering me forward. I thought of conversations I've had with students over the years. I thought of, you know, my participants in my dissertation study, you know, people who are also carrying that weight, and the ways that, you know, we draw upon our spirituality, we draw upon our, you know, communal resources, we draw upon whatever we need to keep walking. So yeah, that was on my mind.
Thank you for being so frank about that and so eloquent. Let's hear from the other panelists. Was there a moment that affected your decision to do this kind of work, or could you talk about how your identities beyond your identity as a researcher led you to this kind of work?
Just to Dr. Morton's point, our ancestors, this notion of they pass down more than trauma, right? We pass down healing, we pass down resilience and resistance. And so that really spoke to me. Thank you for the poem. Now for myself, I can't say there was necessarily a specific moment, but I know that as a graduate student and then as moving into my career as an assistant professor, I wanted to show up in my life and be well, for myself, for my children. I have 4 children, for my students, and for the communities that I care about. And that was going to require a daily and sometimes moment to moment practice of being present, as well as thinking about how to structure my involvement and my commitments in such a way that my wellness is sustainable. And that as I'm pouring into others, that I'm pouring into myself. And then more than that, also thinking about how the spaces that I'm in, at work, at the doctor's office, at my children's school, whether they were also structured around wellness or harm for me as a Black woman, for my children as Black children, for my students who are primarily Black students. But I will say that when I had my oldest child, who was a girl, the fundamental question in terms of my work of thinking about what does it mean to raise a healthy Black girl, it changed. It became more visceral, and it changed how I approach the work that I'm doing. And so in the FIRE Collaborative, which is my lab, we focus on Black women and girls' wellness. And I realized that while I've summed it up in this kind of short sentence, wellness is expansive, right? And so it includes a focus on all the different ways that we're connected to one another, both interpersonally and within systems. So that's what brought me to this work.
Thanks.
I can chime in. What brought me to this work, my work specifically looks at graduate students. And as a graduate student, I had lots of experiences. The poem, really touched me and really does contribute to how I think about my journey in graduate school, but also looking at several of my friends and my colleagues at that time, my peers who were really struggling in graduate school, suffering with anxiety and depression, and being told several times that this is what graduate school is. If you can't make it, then that's on you. You're not tough enough. And it made me question what type of institutions, what type of programs are we creating when anxiety, depression, and fear is the norm? And this is what we want people to do. We want people to walk through the fire. And if you come out on the other end, then you deserve to be here. If you decide that you need to leave, then you're not strong enough. And so I really wanted to peel back the layers of that, because I knew that that couldn't be, I knew that there could be another way. And so I wanted to see, what can we do to inspire wellness, not only amongst graduate students, but faculty, so that we can change the culture of graduate school. So it's about learning and contributing to our communities, and not about walking through the fire.
Thanks. Lauren, would you like to share a little about your path?
Yeah, I'd love to. So I feel like I'm maybe a little bit of a latecomer to the mental health space. I was a student athlete in undergrad. I played soccer at USC. And as a result, I think my mental health was, the least of their concerns, especially at the time, the early 2000s. It wasn't super trendy. There weren't a lot of sports psychologists working with teams at the time. And so, my first real exposure to, I think, mental health issues was through injury. And I had a major head injury playing soccer my sophomore year. And that connection between physical health and mental health, I think, was the beginning of me recognizing, what this space in my life and where I was in undergrad, how that mental health, or how that physical health space was impacting my mental health. And, I wasn't super cognizant of it at the time. I think once I got to grad school was when I really started to recognize what was going on with me in undergrad. And that was because I was working for this organization called the New Orleans Regional AIDS Planning Council. I got my master's at the School of Public Health at Tulane. And they obviously have a huge focus on African-American health. It's a majority Black city. I was coming from USC, which is also located in South Central, another really beautiful, amazing Black community. And I was working in New Orleans, and I was working for this place called the New Orleans Regional AIDS Planning Council, which was responsible for helping HIV positive folks get access to care and the full continuum of care. And so I was charged with starting the mental health and substance abuse resource guide post Hurricane Katrina. So I was literally cold calling all of these mental health services and substance abuse services to see if they would take HIV positive folks, what type of insurance they would take, in order to try to get our social workers able to connect our patient population to care. And that was the rudest awakening, because it was like, oh, actually, there is no healthcare services, mental health care services accessible for a lot of these folks. You have to have insurance to be able to get access to some of these things. The HIV positive status on top of that was another barrier to getting access to mental health care. And so this this idea that physical health is very much connected to mental health was really my gateway into this world of mental health.
Fascinating to hear these different paths that converge in some ways. I think this is a good time to maybe pivot a little bit and to talk about the importance of mental health and well-being across diverse Black communities. How can that issue take different forms across the lifespan for people from different gender, sexuality, social class backgrounds? I wondered, maybe since each of you focus on a different age group or population, maybe you could take that as your point of reference and talk a little bit about what connections do we want to think about across the lifespan. And I think, Lauren, could we start with you?
Yeah, I'd love to start. So I am actually trained as a gerontologist. I got my PhD at USC in gerontology, which just means that I focus on the later half of the life course in terms of my research. And after finishing my master's degree and working at the New Orleans Regional AIDS Planning Council, I moved back to LA. And the first job that I got was with this geriatrician who worked at the LA County Medical Center. So USC staffs the LA County Hospital. And so it's used as a teaching hospital. And the LA County Hospital is a safety net for all of Los Angeles County. So all of our underinsured, underrepresented, Spanish-speaking communities all come to LA County Hospital. And I was working in our geriatric clinic, primarily recruiting patients and shadowing the geriatrician I was working for. And we were interested in thinking about the relationship between hypertension and diabetes and the connection between cognitive decline. And it was in that space where we were talking to patients who were experiencing cognitive decline that you could hear their anxiety about the fact that they couldn't remember some of their kids' names, the depression they had, and the reclusiveness they had, the insecurity they had about sharing the fact that they did have early cognitive impairment. And that, again, that connection between mental health or physical health and mental health was so real in that space. And, you know, as a result, I think most people, you know, kind of figure that at the end of life, anxiety and depression and kind of common psychiatric issues increase. There's actually this U shape between anxiety and depression with age, so that as, like, you know, when you're in your early life phases, adolescence, you have higher levels, it drops in midlife and then increases again in older adulthood. And most people think that's a relationship between just like aging and health, but like as you get older, for every year you get older, your opportunity for anxiety and depression kind of increase towards the end of life. But really what it is that connection to physical health, because as you get older, your opportunity for physical health issues increases. And that connection between physical and mental health is that real, you know, that real piece of that is it increases there in later life. And so as a result, you know, I was starting to think about, you know, this narrative we're telling ourselves for the Black community around mental health and the connection between physical health and mental health. And when you tell the stories around aging in terms of Black health, it's usually very negative. It's a deficit model. We go over time and time again, you know, how Black people have the worst health outcomes, the worst life expectancy, and beyond. But actually, when it comes to mental health, we have pretty good, fairly good health outcomes. And it's exactly what Christina was talking about, exactly what Sienna was talking about. It is that there is this hopefulness, this resilience, some aspect of hardiness that seems to be happening, especially in older adults who have lived through quite a bit of racism, quite a bit of discrimination, especially in the data sets that I'm looking at. We have older adults who lived through, you know, early segregation, where hospitals were segregated, schools were segregated. Then they hit, you know, middle age, and you're talking like civil rights movement. And then you're getting to the Black Lives Matter movement and Barack becoming president. A lot of events happening with older adults that when you get to the end of life, your mental health is reflection of everything that's happened before you. So I really love thinking about mental health of older adults for all of those reasons.
I know our other panelists primarily work with younger populations. Would any of you like to comment on what you see as the important connections across the lifespan?
I was gonna hop on and say, when I was listening to Lauren speak about it, when I'm thinking about, so primarily I'm looking at like Black girls and Black women up to around 35 or so, in between around like kindergarten. So thinking about PK through 16, I'm thinking about how are girls developing the language around mental health or their emotions earlier on, so that potentially when they are moving into adulthood and moving into later life, they have that language to be able to ask for the assistance if they need it, or to be able to name, I'm experiencing joy, happiness, hope, or I'm experiencing anger, anxiety, stress. And so preparing them with the tools, which again, individuals in the Black community may not have had or had access to those types of tools in prior generations. And so I was actually looking in the chat, and someone mentioned that their grandmother talked about having depression as she got older, and how that changed their relationship to them, and thinking about some of the older Black folks in my life where they're like, oh, we weren't depressed when we were younger. And also challenging this notion that maybe in some cases mental health is better in the Black community, but instead, like, are we talking about it? Or are we, a lot of our work in thinking about Black women focuses on like the strong Black woman stereotype, right? Or are we better at masking things? Or are we better at remaining resilient and kind of pushing through and not actually thinking about the physical toll, to Lauren's point, that it may be taking on our bodies? And so when I'm thinking about this younger population, a lot of times I'm thinking about, in the context of identity development and in the context of thinking about wellness across the lifespan, how can we provide tools earlier on so that as they get older, when we do experience crisis, or when we are doing well, how can we maintain wellness or address issues that may be happening?
Thanks. Would anyone else like to speak to this question of thinking about well-being in a lifespan development context?
I just wanted to chime in a little bit. I really appreciate both what Lauren and what Shauna were adding to the conversation as far as, you know, different points in our lives where we might experience those peaks, right? In terms of, you know, concerns regarding our mental health, but then also with respect to Black women, right? The masking that can happen. In my dissertation work, I was really focused on Black graduate women in STEM fields. And, you know, folks ranged in age anywhere from like 22 to in their 40s who were, you know, working on their doctorates. And what I was experiencing, right, was that masking of things. It was like, we don't talk about this here. And whatever I'm feeling, whatever I'm going through, either we're going to have to figure it out privately, separately, on my own, within like very tight knit, close community, or it won't get discussed at all. And so like our, you know, discussions during the research, that was the space, that was the opening, you know, for some folks who hadn't, you know, experienced therapy before. They were saying like, this interview feels like therapy. This feels like counseling because I haven't had a chance to just say, this is what's been on my mind. And also to bring in, right, my work focuses on spirituality as a cultural resource, right? And so folks hadn't had the opportunity to connect like my mental health and what I'm experiencing there, the connections with also my spiritual life and how I'm feeling about this journey, how I'm processing what it is that I'm being expected to do, and how I navigate this space as a spiritual person or someone who's grappling with my spirituality right now, because this program feels like a test, right? And so all of these moments, I think, I'm processing what each of us are sharing and wondering like, yeah, how often do these moments occur where we might be feeling as though we're in crisis, but can't necessarily say or don't allow ourselves to say in order to just move through? Or what are the ways that we cope or find hope, find the encouragement to, you know, prevail through other sources that we also don't commonly talk about, you know, in academic space, like our spiritual homes and communities.
Mhm.
That was what just came to mind.
Well, I appreciate you bringing in this question of spirituality because I feel like it opens the door to talk about other ways that, of course, Black communities are not monolithic. There's a lot of diversity in what we sometimes call the Black community. And so I'd like to take a minute to talk about how some of that diversity might complicate the ways we think about the issues of mental health as they play out in Black communities. So sometimes we use the term intersectionality to talk about how these different identities come together and are experienced simultaneously, but really that's just a fancy word for looking at diversity within the category and being thoughtful about that. I wonder, Dr. McCallum, do you have any thoughts about that?
Yes, absolutely. I think that all of our identities are intersecting and they really do play a large role when we're thinking about mental health. And as I'm looking at and thinking about, race, gender, social class, I'm also thinking about this identity as a graduate student. And that is the identity that a lot of my participants in my research often said that they held. And because they were considered to be a graduate student, often first in their family to go to college, often first in their family to be in graduate school, they didn't think that they had the leeway to worry about their mental health. Because they had, this idea that they were supposed to be strong and they were supposed to persevere. And I'm also a social worker, trained social worker, and once a social worker, always social worker. And so we will often say, hurt people hurt other people. And so reflecting back on the lifespan question is really important to understand how we are experiencing mental health and how we are repeating those patterns. I talked about faculty oftentimes not being as kind as they maybe should to students who are struggling with mental health, and then repeat, because that's what happened to them, and then repeating the pattern. And so it's really important to kind of understand like where we are in this lifespan, and then also how do our identities play into that role. If we're looking at particularly graduate students in STEM, as we know, women are minority in STEM. And so now you're the only Black person, you're the only woman, and now you have to deal with this mental health issue that's occurring in the classroom. And so how are you able to still show up in a way that your faculty thinks that you are intelligent, smart enough, can be in this research lab? A lot of my participants would say, I can't say anything because then my opportunities are then taken away from me because I'm not well enough according to my faculty member. And so it's really important that we understand mental health for ourselves, but also as a community. I always go back to, this that we need to change the culture of graduate school where anxiety and depression is not the norm, but that it is a place where these things can be addressed and individuals can work on healing. And if we change the culture of graduate school, then that will make a big difference. Like the first day of graduate school, everyone should be talking about how are you going to get through graduate school? It's stressful. What are we putting in place so that you can continue to persevere and not act like that's not the norm?
I think that's so helpful because I think sometimes we tend to talk about intersectionality only in terms of identities and maybe pay less attention to how the context or the structure produces the experiences of people with those identities. So I think you've really spoken nicely to that. Dr. Leith, I think you also had some things to share about the role of intersectionality in thinking about Black communities and mental health.
I did, because I think if not all of the work that we are doing in the lab, we are trying to think about Black women and girls from an intersectional lens. Because as Audre Lorde reminds us, there's no such thing as a single issue struggle, because we do not live single issue lives. And so as an example, when we're thinking about Black women's mental health, I'd already mentioned the strong Black woman stereotype, or this notion that Black women can overcome any challenges, and how that might relate to their reports of stress, anxiety, and depression, whether they actually seek out help from family members, from friends, or from clinicians, right? And we have a paper actually that's thinking about this intersection of identity and roles, getting to what you were just saying, Dr. Cole, where we're looking at the strong Black woman stereotype and how intensive expectations of motherhood within the US play out for Black moms and how they show up for their children and may not show up for themselves. But then also pushing this further in the paper, we talk about how might expectations of motherhood affect Black mothers from lower income communities differently, who may have less social support, or do they, right? Let's think about community care and mutual aid. So let's also push back on this notion that if you have less money, you have fewer forms of support, really complicating some of these narratives. How does the racial composition of the neighborhood that you live in affect Black moms' mental health and who they feel can support them or who they can turn to for help? And another project, we're thinking about Black neurodiverse mothers. So what about autistic Black moms and their mental health? Do they have the supports that they need, and what does that look like? Or Black moms with ADHD. Even earlier when Lauren was talking about this connection between physical health and mental health, and this assumption that as we move forward in the lifespan, our physical health gets worse, thinking about the ableism potentially within that, right? What about folks who are struggling with different issues related to ability earlier on, and they're struggling because the world is not accommodating or is not adjusted or set up in a way for them to be able to be successful? And so within the lab, oftentimes we're thinking about when we have a sample of Black women or a sample of Black girls, what is the ethnicity? Let's think about social class in multiple ways. Let's think about ability status, and also recognize our bias in our areas where like, oh, I hadn't considered that before. I thought maybe just thinking about race and gender, or even thinking about gender in binary ways is enough. And in fact, it is not. And so then in kind of getting at the question, I think one of the challenges of the moment and thinking about mental health in the Black community is embracing these more complicated conversations on mental health that account for the complexity of these intersections. Even thinking about Monica Coleman. She has a memoir on spirituality and depression and her experiences as a Black woman, or Basie Ipke, and where she talks about her struggles with bipolar depression. And so also continuing to have these conversations and really think about them in different ways.
I'm sorry, muting is still my downfall. So thank you for that. I want to kind of go deeper into this conversation about how kind of social structure, structural racism, what its role plays in thinking about mental health across the Black community. And by going deeper, I want to talk about this example of the pandemic. So if you follow the news, as I'm sure we all do, you saw every day how Black communities were really disproportionately impacted by the pandemic. The pandemic exacerbated existing disparities in ways that had really sometimes catastrophic consequences. So I'd like to talk a little bit about how you saw the pandemic affecting, in particular, the mental health of Black community members. And I think it will be particularly important to talk about the role of structural racism. Lauren, I believe you were going to tell us something about how the pandemic affected older Black adults.
Yes, I would be happy to start in this space, especially because I think, you know, it was very obvious the extra amount of stress that was present for communities who are immunocompromised, aging communities, and what impact this had on older adults in particular, I think can't be understated. When you have these like big chronic stressors, and I view the pandemic as a stressor that was a chronic stressor now because it's something that's been lasting for years. I view it as something that was going in conjunction with also the killing of George Floyd that was happening at the same time, and Black communities were dealing with both. And, you know, I think a lot of my work is wrapped around this idea of chronic stress and the relationship between chronic stress and mental health. And chronic stress is like this, you know, backdrop that we all experience, all the other types of stress that are happening up underneath that big or larger chronic stressor. And so, you know, this idea that older adults, you know, their actual mortality was threatened during COVID. And that is just a representation of the failure of public health. And often I like to, you know, while the pandemic was going on, I was living in Ann Arbor, and we were, you know, close to Detroit. And I was just thinking about like if you think about like a metaphor of like these bubbles around these communities, protecting them from stressors and bigger stressors than what they are. You know, Ann Arbor has this really thick protection of education, of income, of water supply, clean water, of, you know, infrastructure and healthcare that really maintains a really protective space for a lot of highly educated and white Michiganders. And then you go 45 minutes down the road and you think about that same dome that's protecting Detroit and the Black communities. And you can see the weaknesses. You can see the weaknesses right through them. And, you know, that was really, I think, living within that disparity, or that living within that reality, I think was something that really hit hard at that moment, and thinking about what role we have as Ann Arborites to really engage with what's happening in Detroit right down the street. But beyond that, you know, really, I think there are two things happening with the Black community and with Black older adults that was going on during the pandemic. It was one that, you know, it exacerbated physical health issues. And it's also a natural response to a large stressor to have increases in distress and anxiety and depression. And so that was definitely happening. And I think that's a natural response to stress. And all communities were faced with that. But I also think there was something else going on. So there's quite a few papers published now that looks at white-Black differences or racial differences in distress as a result of the pandemic. And quite a few of them have shown that there were less increases in distress during the pandemic among the Black community than there were among other communities. And that was especially so for older Black adults. And I think that really gets at this idea of like self-sufficiency. If you saw what happened at Hurricane Katrina, you already knew that self-sufficiency was going to be necessary. You already knew that you were going to be isolated and alone and trying to deal with some of these things. And you already knew that the community around you was really going to be the resource you had in order to do that. And so maybe it was less of a shock. There was less of a change for Black people and thinking about what was happening with the pandemic relative to other communities. Because our stress levels are already high, we're already overexposed to stress. It also highlights the fact that we're already coping and we already know how in a lot of ways, you know, that especially older adults who've been doing it since, you know, for the last 60, 70 years. So I think, you know, although the resilience narrative is annoying and it displaces a lot of issues that really do happen in the Black community, there's also some very real self-sufficiency happening that without intervention, without anybody coming in and doing anything, Black communities are already doing a lot of that work for themselves.
Thank you. Does anyone else want to talk about how they saw the pandemic affecting mental health in Black communities?
I'll chime in. Well, I just have to say, Lauren, yes to all of it. I was like, I can't be snapping on and lifting my hands up, but anyway, yes, I can. Everything to what you just said. You know, I have a forthcoming paper with a dear sister scholar of mine, Dr. Ebony Peruse Harvey, and it's talking from our personal experiences during the pandemic, where we're describing what it meant to be young mother scholars having children for the very first time during the pandemic, and the ways that we needed to really call upon that communal care that Shauna was talking about earlier, right? And, you know, as Lauren was talking about that self-sufficiency, I was like, that's exactly what happened. It was like family, friends, community being like, hey, we all we got. What do you need? How can I show up for you? I might not be able to come into your house, but I'm going to cook you a meal. I'm going to leave it on your doorstep. I'm going to call you. I'm going to, you know, just check in and make sure, because I know that having a baby, period, is hard. But having a baby during this pandemic, when you can't access the same forms of care, like, I'm just checking on you, right? And those were the honest conversations and moments that really kept me sane, because I had no idea, you know, what any of that would be like, you know, navigating parenthood as a first-time mom during a pandemic, not knowing whether or not my partner would be able to even be in the delivery room with me when I was having my child, like all of it. And, you know, what we talk about in that paper is, even though the care was a bit different from what we originally anticipated, the care was there. The love was there. The community was there. So, you know, just talking about the ways that in Black community, we make a way. It's like you will figure something out. You know, it may be imperfect. It may be a little bit more complicated or cumbersome in certain ways, but it's just like, okay, how are we going to do this? Because we have to do this. And ways that we show up for one another in that as well, and how it positively contributes to our mental health, our spiritual well-being. All of that is so key.
Those were such powerful examples from your personal experience. And I see in the chat that someone's interested in thinking about how can we be proactive in maintaining our own mental health? How can we reach out and help others? And I think it's particularly important to talk about this in relation to the pandemic, because you know, some people are saying the pandemic is over, but we know that people are still dying of it every day. It keeps mutating. You know, it continues to be an issue. What can we do? Shauna?
You know, I was actually wanting to chime in on the other piece of what Christina was saying. We had a paper, and thinking about the pandemic, and then also thinking about police brutality and the resurgence of protests during, especially in 2020 in particular. We have a paper on racial grief among Black mothers, and also the importance that even as folks, we found new ways to show up for one another, that maybe that there was also grief in that experience, like losing actual people, and then also potentially losing some of what we expected to be able to do, and having our partners in the labor and delivery room, having family members there. If in fact, for the folks who died, who got severely sick with COVID-19 or other illnesses, not being able to have supports. And so in that paper, we specifically talk about the importance of feeling that grief, recognizing it. What does it mean to feel through it, to seek support that you need? And then also racial grief as a function of racism, that yes, we have grief because we are living in a society that is racist, and that is a normative and adaptive part of having to find ways to cope and to find supports. And so I just wanted to also highlight that as a part of the pandemic. But back to the question, sorry,
Yeah.
Dr. Cole, that I kind of diverted from.
Did you want to talk about things we can do to be proactive, or?
You know what? Because it's going to be a pivot to talking about Black girls in schooling spaces. So I'm going to let someone else chime in and then see.
Okay.
I would chime in about the pandemic, because when we first started doing our research on Black graduate students and mental health, we were not planning on having a pandemic. Okay, the pandemic happened in the midst of the research. So it really did change the nature of our conversations during our qualitative interviews. And so we were able to really tap into how people were experiencing it at the moment. A lot of the graduate students, of course, were very upset because they had to stop everything. Like Christina probably knows this, like some people actually had to change their home topics because they couldn't get people to interview. IRB stopped, right? And so it was a lot of frustration and sadness around that. But there were also these other moments that I found really interesting as far as mental health. So some of their participants really talked about that this was the first time in their lives that they ever had an opportunity to stop because the world made them stop. And so when they were not paying attention to their mental health, now they had time to do so. So a lot of the participants started going to therapy, or actually showing up for their therapy sessions when they weren't before, because they were on Zoom and you can click a button and go to your therapy session, right? Some of our participants actually became more involved in the community because they had the time to do so. The world had stopped. And so although there's lots of negative impacts that happen because of COVID-19 and the experience of the racial pandemics, these other aspects I think aren't talked about as much, right? Like there was this opportunity to stop and think about wellness and think about how you can continue to take care of yourself even as you move forward, right? How you can continue to be involved in your community, how you can use your voice to speak up in ways. One of our participants talked about, I was quiet before and now I'm loud and I plan to get louder, right? Because now she was being able to tap in. And so all of those things happen, I think, as a result of the pandemics. And I think it's directly because we all had to have an opportunity to really stop and take care of what was important. Many of those who were in our study also questioned, like, do I want to do this? Like, do I want to live in this ivory tower and spend all my time writing and researching papers and writing journals and putting them into the library where no one is going to read except for another graduate student when they get ready to do their dissertation? Or can my life be something different and kind of being torn between what advocacy looks like? And that's something that I really resonated with and also was torn with as a graduate student. And even now, like, where should I really be spending my time? Is it working with students, which I think it is, right? That's why I'm here. Or is it in some other space? And can I be in both spaces at the same time? And how is that really impacting the community? So at this point, I think I'm spinning off the question, so I'm going to stop. But I wanted to highlight some of those findings because we were in the midst of COVID at the beginning of our study.
Thank you for sharing some of the things you learned through your research. And one of the things that I think is making this conversation really rich is the way that you're weaving together your personal reflections and what you've learned through your scholarship and research. I would like to come back to this question of what can we do? You know, we all occupy different roles, whether as educators, researchers, clinicians, or maybe we're leaders in our community or churches or parents. Many of us occupy several of these roles. How can we be change agents to transform the policies and the practices and even our culture so that it will be more supportive of mental health and well-being? And I guess, you know, I'm asking that in a general way, but, you know, I think what's really at question here is how can we use those roles to support the mental health and well-being of people in Black communities? Do you have insights about this from your research or scholarship? What we can be doing? Yeah.
I can chime in really quick. There's a couple of things that I was doing before the pandemic and I still do, and that's talk about mental health in every single class with every single student whenever I can. So that is not a taboo topic when something comes up. We already know that, you know, we can have these conversations, and my syllabus is really long because I put resources at the back, not only for mental health and counseling, but for food insecurity, for resources for graduate students that they probably tell graduate students about the first day of class, and no one, when they get admitted and they don't remember, right? So all of that is inside of my syllabus. I've also started a program at Eastern called Mentoring for Life, and it's really mentoring for life and well-being. And part of that program is working with graduate students. It's an NSF funded program, and teaching them how to be mentors once they graduate, but also how to advocate for themselves as mentees while they're still in graduate school. And a component of that is all of our participants attend a growth group. So in that growth group, they're able to talk about mentoring, but also what's happening to them in their day-to-day lives. And these growth group sessions are facilitated by counselors. And so they're attending to their well-being and mental health, as well as working on becoming mentors. And so putting programs in place like that, I think can really help facilitate graduate students as they're trying to transition through the program and work on their mental health and well-being.
Thanks. So it sounds like your program's very intergenerational.
Yeah, so because we have graduate students who are just beginning, but also graduate students who are seniors. So, you know, graduate students lifespan from early 20s to late 50s. So we do have students of all ages.
Thank you. Shauna.
Yeah, I've mentioned that I've been thinking about this quite a bit with our work with Black girls in educational spaces, particularly around initiatives that are supposed to address socio-emotional development or well-being for students, and within public school context or in contexts that may or may not have the resources to show up for students' Black girls' mental health in the best ways. And so we have a paper with a colleague, Dr. Misha Enos Thompson, she's at Cornell, where we're talking about the importance of Black girl spaces, specifically in after school programs or in school programs where Black girls can show up in the fullness of who they are. And I think that applies for all Black children. And then in relating it to socio-emotional development, really reconsidering policies or practices in schools that are punitive or are shutting Black children down and talking about their feelings or being able to speak up and voice, I didn't like what you did there. I don't like what happened. Can I ask questions? Are children able to get curious in ways that would support their mental health and well-being? And we talk about that in the paper. And I think a piece of that is also really rethinking social structures that are hierarchical. So a lot of times within some of the schools that I've worked with, a lot of the focus on socio-emotional development focuses on peer-to-peer interactions, but there's much less focus in thinking about teachers or school leaders or adults in the school and thinking about how are we supporting mental health by allowing, again, children to question adults and kind of upending that. And then when I'm thinking about what I'm doing in my role as a professor or for my students, again, where I'm in a position of power. Since the pandemic, you know, I think I was doing this before, but also doing it at department-wide level, rethinking, like, do I need someone to be here? Like, again, what expectations did we have about like physical space or physical presence around working that we found out that's actually not true? And I think that there are a lot of scholars in disability justice who again were saying these things and saying, we've been asking for these types of accommodations for years and you all were not listening. But now that able-bodied people are saying, oh, we need this because there's a pandemic, we're listening. And then there was also this push at many universities to go back to normal now that, you know, in some cases, levels have gone down. And so that's one way where, again, I was just questioning myself a lot. In that position, and then also within the work within education, like pushing schools insofar as they can, while also trying to meet all of the needs that they have for their students, which I recognize, to just think again about wellness in an expansive way and thinking, are certain policies doing harm? And are there possibilities we can envision, like thinking beyond the scope of maybe what we have done in the past and seeing the pandemic also, to what Christina and Karma were saying, like pushing us to think more radically about what the world could look like, and then breaking it down into policies. What does that look like on day-to-day steps and what's within our power to do? So
Thank you for those observations.
I just wanted to say one quick thing, super fast. My dear sister and good friend, Dr. Danielle Busby, and her colleagues have founded an organization called Black Mental Wellness. It's blackmentalwellness.com. I'm saying it here because their entire group is focused on destigmatizing mental health in the Black community. They're providing training, they're doing workshops, they're going into schools, they're talking to a variety of audiences about how to discuss this very thing. I think so often in academia and higher education in general, like we try to reinvent the wheel that is already rolling. Like, you know, there are people in the community who are doing the work, you know what I'm saying? So like connecting to those communal resources and finding, you know, folks who are in it. I mean, hands are in it is so essential and key. You know, we don't have to do it all over again. So I just wanted to shout out that organization. I think that, you know, connecting with groups like that, and there's so many others out there as well, are ways that we could just get started without so much of the bureaucracy and the time that we take up trying to figure it out on our own.
Thank you for that. And I see some people are sharing some other resources in the chat, so you might want to check those out. Lauren, did you want to comment on this about what policies or even practices you think we can be promoting as in our leadership positions or in our communities?
Yeah, a lot of my work really focuses on measurement and how we measure mental health in the Black community. And mostly of what I've noticed is that we've taken all of the mental health scales that we've developed for white populations and just smacked them onto Black communities rather than developing measures that come from within our own community and apply to the way mental health manifests within our own populations. I think measurement is a huge issue in the research space in what we know about mental health. I also think a lot of things with the DSM mental health is tied to culture, severely tied to culture. When we use things like the diagnostic manual, it does things that really are related, I think, heavily to white supremacy, and renaming and rethinking mental health for Black people, I think has to come from within, which is why these organizations that Christina mentioned are a really beautiful space to start thinking about rebuilding some of these ideas. But I also think we're making maybe a mistake here in not separating out like severe mental health illnesses from like anxiety, depression, and things that are very much more common in our functioning workforce and all of that. So, you know, I think when we think about severe mental health problems, we need to be talking about institutionalization and prison abolition. And that, you know, is the first place to start in terms of the extreme spaces and what's happening on the margins. That's really where we need to go in that space. But when we're thinking about like generalized populations, anxiety and depression, I think we can really start with things like stress exposure. One of the things that I found in my work, the chronic stressors that Black older adults face more than any other group of older adults is chronic housing insecurity and financial insecurity, financial strain. Those are stressors we can adjust, especially for older adults. When you think about the fact that older adults are often living on Social Security, they're not entering the workforce, and it really requires policy action in order to support the health and well-being of older adults. And that housing is healthcare. If you house older adults and you give secure housing, you have what is effective healthcare for older adults as well. Those go together. And I also think, and I will always push this, is that rest is resistance. And, you know, many of you guys, I'm sure, know about the NAP ministry. I'm forgetting her name, Trisha Hersey, who started the NAP ministry and just put out her book called Rest is Resistance. We need something like siestas or something, you know, like something we can implement in a day-to-day that's like, where we are actually saying to you in a policy way, in a way that's put into your routine and schedule, oh, we're prioritizing your mental health. Oh, we don't just focus on capitalism. Oh, your body isn't just a tool for work. You know, those things I think are really important for Black people in particular, because our bodies have been used for work. And because rest is a function that we've never had access to in the past, that would go a long way in restitution and thinking about the ways Black communities have been told that our bodies and working our bodies is the only way we have value in this community. So I really think that's part of the conversation we need to be having and thinking about, you know, severe mental health versus more common mental health issues that we think in the general population.
I really appreciate you bringing back into the conversation some of these areas of structural inequality, the question of restitution to Black communities, the incarceration crisis. And it makes me think it's worth talking for a minute if you have any thoughts about, have you seen explicitly anti-racist models or interventions around mental health and wellness? And what were those like, and how have you seen those work? Sean, I saw you nodding. I don't know if it was because you were interested in the question or you had some thoughts.
I was nodding and thinking, and I was actually mostly going to say, what I've seen is thinking, to Lauren's point about rethinking institutionalization or prison abolition. So I was thinking about group therapy models for Black women and girls, thinking about the paper that I mentioned earlier around Black girl spaces, thinking about mutual aid, and that's not specifically, actually, no, it is. It's not intervention in the traditional way that we think about interventions, but these models are very much rooted in community, very much rooted in the power of people coming together, and they're already defining the needs that they have and saying, in the Black Girl Spaces model, or there's an organization called Radical Monarchs, which is for Black and brown girls of color, which is divergently different from the more traditional like Girl Scouts or Cub Scouts, because within Radical Monarchs, they're saying we need to center Black girls and Black and brown girls with their specific needs around racism, sexism, ableism, and so I wasn't quite prepared to answer, but I guess I am. And just thinking what I'm seeing, so even what Christina was saying, like communities already doing and have been doing, but it's beyond a bit of my wheelhouse in terms of I'm in the process of building some of these relationships within St. Louis and with other organizations. And so we don't have anything actively in the lab going. Yeah.
Thanks. Have other people seen policies or interventions that are trying to foster mental health and wellness in Black communities that are explicitly anti-racist?
So a colleague of mine that I'm working with, Morgan Brian, she has a professional development opportunity called The Witch. And I was trying to recall it. The Witch, it stands for something. I apologize. She's going to be very upset. I can't remember what it stands for. But it's a professional development opportunity that she has developed using theater and also research to work with pre-professional teachers and counselors around Black trauma and grief, and how that shows up in the classroom, and how teachers can respond differently based on their understanding of what's actually happening in the classroom. So as we're thinking about disciplinary actions, as you know, what does that need to look like? How is that different if you understand the trauma that this young person is going through? And so I think programs like that are really trying to do some intervention around how we think about it, and particularly Black boys in the classroom. So I did wanted to mention her professional development opportunity that she is introducing into some higher education spaces, as well as K-12 spaces and communities.
That's great, thank you. I think soon we will be moving into some of the questions that we've been receiving in the chat. And if you have questions that you haven't shared yet, I invite you to do that. But before we move to that, I would like to see if you have some concluding thoughts. And these could be things that you wanted to talk about that we didn't get to, or they could be ideas that have occurred to you throughout this rich conversation. Let's see, Christina, since you started us off, would you like to begin closing us out?
Well, thank you. I mean, I first just have to express my gratitude for the invitation to be here, and also just for the privilege of being in the presence of such brilliant, phenomenal, dope sister scholars in this panel. I feel like I've learned and received so much. My cup is overflowing, just hearing from all of you. You know, as far as a remaining thought that I have, I'm sitting right now with the idea of, you know, which interventions we might be aware of that, you know, are explicitly anti-racist. And in some ways, I wonder like how the labels that institutions place on things so that they recognize what it is obscures what's currently happening and existing in communities where it's like, it's anti-racist because we center in Blackness, period. You know, like we won't call ourselves that or label ourselves in that particular way. And wondering how institutions can begin to recognize, you know, language that's beyond the jargon, that's community-based, that's integral, that's understandable and accessible to the communities that are being served, right? So I think that's something that I'm just sitting with right now. Yeah, but I'll stop there and let others chime in.
Yeah, other concluding thoughts?
I can share some final thoughts or things I wanted to bring up that we didn't get to. One being that I just saw, you know, they started the suicide hotline. I think Biden put on this national suicide hotline where people are going to have access to, you know, 24/7 potential crisis hotline. And we've put this huge emphasis on therapy and very much thinking about like individualized responses to the mental health crisis, or what's been labeled the mental health crisis as a result of the pandemic. Highlighting, like, I think on a national level that mental health is important, even though we've kind of already known that. I feel like a lot of this conversation can be really harmful to think and push therapy and things like hotlines as means to solve what's happening, or the mental health spaces is particular for Black communities, because a lot of this is very much geared toward the majority. And this idea that we have constantly and consistently developed responses to health issues in majority white populations, and then expect people on the margins to get on board or to just figure it out, or, well, we already offer all of this, why don't you take advantage of it? You know, I think a lot of this space can be really problematic. So I just, you know, I see a lot of this on Instagram, all the self-care, you know, going on vacation, going to get massages, all this kind of talk that's really happening in social spaces and in the virtual platforms about how you can achieve your own mental health and well-being. You know, I think a lot of that, while it can serve to help you momentarily, is really not the answer to what are some of the long-term issues here we face as a Black community. It's been beautiful, really beautiful to be on this panel with you ladies, and I'm honored to be a part of this conversation, and even having the opportunity to speak in a forum where you guys are all showing up to hear and think about this issue. It's really, truly beautiful.
I think I can add on to that. One, I'm leaving the panel excited by the possibilities of knowing that we opened this with spoken word poetry, that throughout this piece, we've been shouting out other folks who are doing this work, talking about community organizations, saying, you know, there are all these connections to be made. And I think that that points to the reality that we're all necessary within this movement of improving mental health in the Black community, and also naming the issues for what they are. I could barely sit in my seat, earlier when Dr. Brown was talking about housing insecurity and talking about prison abolition and saying all of these things are interconnected and all of these things are related to mental health and wellness in very concrete and tangible ways. But to be hearing that as part of, this panel discussion and being able to be here, I want to say, thank you for you all being here, because that also shows a commitment, and you are part of this community, obviously. And also the importance of focusing on everyone. So thinking about the children, right? I'm talking about youth quite a bit, but also thinking about elderly folks and older folks, and that we're not letting anyone go or say that anyone is too far gone or not worth thinking about incarcerated folks or folks who are experiencing incarceration, that they're not also part of this conversation, an important part of thinking about wellness in a holistic way. And then lastly, just the importance of listening. So, here we are, we're doing a lot of speaking because we are the panelists, but I would say when I'm thinking about how we're improving mental health in the Black community, that it's critically important that we're listening again to all the voices and what they're offering us, and what that means for the initiatives and things that we think of and we try out and work towards.
Thanks. And Carmen, I wonder if you have any last thoughts.
I think my brilliant panelists have summed everything up. I'm like Christina, my cup is definitely full. It's been a little difficult not to sink into the space of a participant, because I'm just in awe in the brilliance of the panel and appreciate all of the information that was shared. And I think, I had something I prepared for concluding thoughts, but really what I'm sitting here thinking is, we're gonna be all right. We really, truly are. We are working together. We are working in community. There's so much good work going on in this panel. We are not alone in this ivory tower, chiseling away on our lonely scholarship. We are part of a bigger interconnected community. And I hope that we can continue to do more to stay connected to each other around this important work. It's something that I think is more on the forefront right now than it has been in the past, but that doesn't mean that it hasn't existed. It's always existed. Now that we have this platform, I think we should use it. And as my participants said, I was quiet before, I'm loud, and I plan on getting louder.
Thank you. Before we move into the Q&A, I just want to acknowledge and express my gratitude for the wonderful engagement that we've been having throughout this conversation in the chat from our attendees. I think in general at our NCID events, we get wonderful, really engaged audiences, and I think that's just been particularly through today. Not only have they been expressing their appreciation, they've been sharing resources, sharing knowledge, and I think the chat has just been a great source of community, and it makes me think about the title of this session, that it's about heart, soul, and mind. And I really think that, all three dimensions of our humanity were engaged throughout this conversation. So thank you to everyone. And that's a good segue to start to engage the panel in some of the questions that have come up in the chat. Some of them I think we've kind of touched on through the conversation, but one that came up that I thought was really provocative was, does the ivory tower have a responsibility to work with the Black communities they're in proximity to? And I think that's interesting to think about a responsibility both at the institutional level and for those of us who are fortunate to be scholars and teachers here. Is there a responsibility? What is that responsibility? What do you think about that?
I can hop in on this question. At this point, I've been employed at 2 institutions that both have ties to the enslavement of African descendants of slavery in this country. And so that's an ongoing conversation, and thinking about the particular histories of Black folks and what responsibility do those institutions have to Black communities where we are oftentimes like housed in the midst of intergenerational Black families, right? I think first and foremost, yes, there's a responsibility in responding to the question. Now, figuring out what that looks like, In some ways, we've seen some efforts where at one, maybe they're taking down, for instance, monuments or testaments to white supremacy like Confederate statues, but is that enough? And is it happening in conversation with the folks who live within those communities and who have been there? That's not necessarily always the case. The other piece about it is, I think commonly we see the disconnect or a narrative where there has been a lot of harm and or mistrust, or as faculty members, we've gone into communities and done research and left. And that is very much so true, but then also thinking about sometimes these communities, there's no need for more research, or they've already told us what, in thinking about housing insecurity or in thinking about access to maybe mental health supports, like they don't need more professors in those spaces. They need more resources. And at both those institutions, I think those resources are available. Now, what does that look like in terms of how those funds are being dispersed or brought about? I don't know. And I think that is an ongoing work in progress, hopefully at both places and at other universities across the country. So this is something that that I care about deeply. I also want to say too, okay, but how, in terms of what this looks like or how this goes down, I am concerned about who they are then bringing in to make these decisions, because also we don't just need us to just be sending people out from universities who are not equipped or who are going to do more harm. So that's just last nod that I need to say in some of the conversations I've been in, where absolutely not, I do not want you sending out so-and-so or these students or this effort, it will be harmful. And so I guess speaking up in that way.
I think what Shauna's basically saying is the duplicitousness of this and how conflicting this question is for us in particular, as people who are very well experienced with white ivory towers and the harm they do to us and the fear we have of them doing that to anybody else. It's like this, yeah, it's an ethical conflict, to say the least. And, I've lived in South Central for 15 years now. And there's something unique, I think, in particular with USC and the fact that they have a university that is in a Black community. And whereas most of the time you get institutions like Ann Arbor, where you're actually pulled out of the Black community and put in white college towns. And so I think maybe there needs to be some distinction about the difference in responsibility for different institutions, also based on where they're located. But for example, USC is not paying taxes in South. So why does USC look so pristine and the rest of South Central look like there hasn't been anybody planting trees, going around, taking care of the grounds and beyond? So, in my opinion, USC owes South Central quite a bit of restitution as a result of taking over and occupying that entire community. Now, not only does USC occupy all of South Central, but they're putting security guards in the community to protect the students, but totally disrupting the flow and function of what's happening in the community otherwise. And so I think that conversation for institutions like USC is very specific, whereas institutions like Michigan, who are in Ann Arbor and have been are totally isolated relative to the Black communities, what that looks like for them, I think needs to be talked about maybe in a different way. And I'm less familiar with those institutions because I went to USC and to Tulane, who were very much nested in Black communities. And the visual of what that looks like, you can see that separation. It's harder to see in something like Ann Arbor and Detroit, where the separation is 45 minutes to an hour. And you don't see that direct relationship between the institution always and the community. And so I think this conversation it's a scary one to have, because we understand that sometimes universities don't help, they harm. And so, figuring out that balance of how to engage with all of our resources, but not do more damage than good is part of this conversation.
I just wanted to chime in because I can actually see the question in the chat. Do ivory towers have a responsibility to work with Black communities? With is in all caps, right? And I think that was what I was honing in on. I think universities often confuse with, oh, I work in Black community, I work for Black community, but no, with implies that the community is taking the lead and allowing the university to know this is what we want. These are our desires, and trusting that the folks that you're saying that you're working with know what it is that they're looking for from the institution, right? So in that case, right, it should be, you know, a community-based intentional effort that's not being driven by the institution. And that's a whole reframing, and actually bringing in people who are skilled, qualified, and committed to that type of work because they exist. We exist, right? And not just to put it on the website. Oh, we consulted so-and-so. You know what I'm saying? So I feel like I'm hearing that in my fellow panelists' comments as well. Like, let's be clear about what we mean by working with. Let's be explicit about that from the jump. Who's driving?
Thanks for paying attention to that nuance. Carmen, did you want to speak on this, or should I take some other questions? Okay. We've had a couple other questions come in specifically about, you know, the experience of people at universities. And I think I'm going to take these two and kind of combine them, and you can speak to either one that you would like to. We've had a question about what are some of the ways that Black tenure track faculty can care for their mental health while they're moving through tenure and promotion? And then we've also had a question about how Black faculty can continue to support their Black graduate students in ways that don't either stigmatize those students or look like the faculty are favoring them. So we have a question about faculty. We have a question about faculty, Black faculty working with graduate students. Do you have thoughts about this? Maybe I'll ask Carmen to start us off because your work is on graduate students.
It is, and I was sitting here. I think it's a double-barreled question, so I didn't know where to go. But I think I will start with the faculty, and I think really what you have to do is you have to build your community. You have to have folks, and maybe not necessarily inside of your department, but within the university or outside of the university. I often talk to my students, and Christina knows this, about having a whole pie, right? And each person is a slice of pie. And so, you know, you might get apple in California and blueberry in Florida and cherry in Wisconsin. Like, you have to find your network. You have to find your people where you're able to have these really difficult conversations about what's going on in your department, or for you as an individual, as a faculty member, and be safe and still be able to move forward and get your work done, right? So figuring out, what does that mean for you? You know, are you making sure that you schedule one day a week where you're not taking any meetings so that you can write? Are you making sure when this break time that you are taking an actual break, not on the beach on your cell phone answering emails, but you're on vacation, right? So you have to make sure that you actually are taking care of yourself. And I think as far as your graduate students, I mean, the reason why I'm hesitant is because I don't really care if someone thinks I'm favoring my Black graduate students more than other students. You know, no one seemed to care when I was in graduate school and they were favoring the white students more than they were favoring me as a Black student. And so I definitely pour into my students of color. And I pour into all of my students, but that's just not a worry of mine. I'm going to make sure that I figure out how to connect them to the people, the resources and experiences that they need in order to move from my space as a graduate student into the career that they want. And if someone questions that, I just push back. I remember early on in my career, someone asking me, why are you going after another grant? Like, you already have a grant. Why are you going after another grant? And my answer was, because I need to fund more graduate students, right? That is my mission. Like, I want to make sure that graduate students are taken care of in a way that helps them in multiple ways. And if the institution is not going to do that, or my department is not going to do that, I'm going to figure out a way to do that for my students. So I can't answer the part about, what do you do to not show favoritism? You know, life is not fair. That's what I've been told. So, but I am going to pour into all my students the best that I can.
Well, thank you. I think that was a great note to end on. We are actually 2 minutes past time. So I want to close by just thanking our panelists again. This has just been sort of a model of the way you can weave scholarship with memoir, with the arts, to engage a really deeply meaningful conversation that has policy implications, and then that also was just really restorative for all of us here. So thank you again. This was like a master's class. I want to thank the staff at NCID who put this event together. And once again, I want to thank all of you who made the time here to be with us. And I hope it fed you the way it fed us. And I hope you all get a chance to reflect on this and to take your rest as resistance. Thank you again.